And thank you for joining us. May is Mental Health Awareness Month, and joining us is Dr. Philip Tallarico.
Hi,
good to see you. Thank you for being here.
Of course.
Before we get into behavioral health, tell us a little bit about yourself. Where are you from originally?
Well, I grew up in Pittsburgh, south of Pittsburgh, and went to college here, actually. I wanted a town that was smaller. You know, a lot of my friends from high school went to Penn State, and I enjoyed those schools. I just wanted something that would provide a little bit more of a smaller atmosphere, not something so large. And so completed college here, and then went to LECOM for medical school. And when it was time to come back, or time for my third and fourth year for my rotations, I was familiar with Meadville and thought, well, let's see what's going on here at the hospital, and had a chance to come here for my final years in medical school, and just really fell back in love with the community where I was. And I remember a lot of times in college there were people who, it's a really big time for people to have depression, have anxiety, or substance use, right? And you would see people that had so much potential and kind of just get distracted. And growing or being in college with those sort of people, people that needed additional support, it was important to me that I'd want to help those people now. So I figured, well, it'd be great to come back here and work in this area. Fell in love with psychiatry. I actually wanted to do anesthesia to begin with. And then when I came here and how the psychiatry program was here, it was something that really connected with me, and I felt that I would like to go in that direction. It was already sort of there, and I think I just needed a bit of a nudge, and after that, it just sort of took off, went to Detroit for residency, and back here. So been here for 4 years now.
How many times did you walk past Meadville Medical Center and just thought, yeah, I could see myself?
Yeah, it is, because this is the third time that I've moved here, and I hope it's the last. I don't plan on leaving, but there were a lot of times, or it is interesting just driving through the college now. A lot of the buildings that I would stay in or be at aren't there anymore, and just driving through the area, talking to my family about this was everything. This is how it is. Now, it is sort of wild to think about the transformation that's happened over the past, I guess that would be 20 years now, geez.
It feels like 2.
Yes, thank you.
So when you got started to now, what has changed?
Well, one thing I would say is that when I came in, I think that we were going, psychiatry at Meadville was going through a transformation. One of the things that, for a long time, there were a handful of psychiatrists, 2, 3 psychiatrists here. And actually at one point, when I first came here, there was 1 to 2, right? There are 5 psychiatrists in the area now, which is wonderful, because as I was saying, it started off with 1, 2, and there was a lot of turnover. So in addition to that, we have some extraordinary therapists who we've been able to pretty much fill everything at our location at Mind Body Wellness, but also over at Alden Street, Meadville Community Health Center. So that's important to us as well.
You talk about the growth. I would imagine that's to sort of cover every possible, I don't say problem or issue, but there's a lot area
perhaps,
because there is really a lot to cover, and there's so much that has changed in behavioral health.
I think I would say that at some point psychiatry or mental illness or whatever you want to say will impact all of us at some point in our life, whether it's hopefully not, but very, very early in our lives, if we have a friend that passes away, or a parent,
a pandemic.
Or a pandemic that completely alters the way that society functions, right? And into your college years, as I talked about, where there is a lot of distractions and a lot of increase in anxiety, as in your 20s, where you kind of starting your life there and starting a career and a family, or it could be more into, you know, your 50s or 60s, you're losing a spouse, you know, or we see the way that dementia, things like this can cause cancer, can cause so much pain throughout the family, right? So at some point it will affect all of us, right? And a lot of times I encounter people who say, you know, I ignored it, I pushed it off, and I can't do that anymore. And I would suggest that, you know, it's going to always be there, so it's best to address it so that we feel like we can process things and continue on and thrive in our life. One thing I would say is that it's not just, a lot of times we talk about psychiatry and we think about medications, and yes, psychiatrists kind of get funneled, being medical doctors, you get funneled into that area. But it doesn't have to be medications. A lot of times people think, well, I'm not interested in medications, and that can be fine, right? There are so many other things that can help your mood, especially when you're feeling down, right? Things like vitamin D, sunlight, sleeping well, eating well, exercise, socializing. When you brought up the pandemic, that was something that affected us, right? The way that we had to withdraw, the way that we were isolated, the way that we couldn't interact with our loved ones. I tell that to people who retire. Congratulations, but now you kind of got this whole other area where you have to tackle, and that's filling this 8-hour void of feeling purpose, right? Whether it could be anything, you know, hobbies, interacting with
kids graduating.
Friends. Yeah, absolutely. So it is it's something where it's going to affect us all, and it doesn't have to be medicine. Medicine is one piece of the puzzle, and it is very useful, but it doesn't just stop there.
And not to go back to the pandemic, but something I did hear, and I mean, it's affected students, you know, all the way up, but I've heard people actually say, I never really thought I could deal with things, but with the pandemic and just being, you know, cut off and isolated, and it really threw my mind in a different way, or I recognized certain things that maybe I didn't see before or acknowledge. I'm sure you get a lot of that where I think I can deal with it myself, but the reality is I can't. I need to talk to somebody.
Yeah, there was what it did for it was brought a really harsh reality and hit people in the face, rip the Band-Aid off, whatever you want to say. That's what it did. We really benefit from structure and routine, and that just completely went out the window. And the people that need structure and routine the most are, you know, teenagers, right? The ones who, you know, it's teenagers are going to go to bed late and wake up late, these sort of things, and that's totally fine. But when it comes to school, when it comes to structure, if there isn't that sort of exterior support the way that you were getting the pre-pandemic, then it's very easy for people to sort of drift off the way that you can if you're at home, or whether you're working from home, which, you know, is completely fine, and how people have really been successful in that. But some people certainly benefit from that structure and routine that you're talking about.
The wellness side, just, you know, looking at a patient overall, there's so many aspects, right? We talked to, you know, doctors, nurses, now the mind-body aspect of it. The mind plays such an important role in one's health that I think sometimes, like I said earlier, I think it gets overlooked.
Yeah, it's one of those things where we'll talk to people and they'll say, well, but I have mostly physical complaints. My stomach hurts, my head hurts. And we oftentimes say it is, as you said, the mind is a very powerful thing, and it's all interconnected with our body. And if the mind is not feeling well, the body generally doesn't feel well. And conversely, though, if the body doesn't feel well, the mind doesn't feel well too. I interact with a lot of people with chronic pain, and it's very easy for something like chronic pain or any sort of chronic inflammation to create a depression, create an anxiety. Whether it is from that chronic inflammatory state that can create anxiety and depression physiologically, or if it's just I'm older now and I can't do the things I'd like to do, or I'm not as independent as I'd like to be. So it is all very interconnected, and that's one of the things I love about this area and what we provide is that we have, not only do we have the psychiatrists, right, but we have the therapists, we also have dietitians. We have neuropsychologists who are able to evaluate for ADHD, for autism, for dementia. So it is a very sort of well-rounded approach. And kind of going back to what we started with, oftentimes, or people will say, well, where do you live, or well, where's Meadville, right? And you say, oh, an hour and a half north of Pittsburgh or something like that. But the truth of the matter is, one of the main reasons why I wanted to be at this hospital was because it was an independent hospital. I remember the day before I took my psychiatry boards, the CEO of the hospital, he called me and said, hey, good luck. I don't know if you would get that from a large facility, right? So that was something that was very important to me. And a lot of times my patients will say, well, I think I'm going to go to the Cleveland Clinic for this, or I'm going to go to UPMC for this. And that's fine. I mean, those are institutions there because of the degree of specialty that they provide. But I think it's also important to recognize that for a small town like Meadville and the areas that we service, we have an extraordinary amount of specialties, and I'm really proud that psychiatry is able to get to that level now, and the services that we're able to provide.
Sounds like for you, the other part of that is you get to visit with a lot of people. It's not just one thing every day.
Yeah,
every day's different for you.
And that's what's honestly so much fun about the job, is that you see people. I don't love to see people in distress, but you see them. I work in the hospital, right, in the inpatient unit, but I also work outpatient. So you have that continuity of working with people. You can see somebody inpatient who is very acutely ill, and over a few weeks you're able to get them back to where they're able to function in society. I love to hear family members or spouses say, I have my son back. I feel like I have my husband back, right? Those are really, really important things. And that's more of that's sort of how this job is rewarding. We're not surgeons, we're not in trauma bays, and we're not saving people's lives right there. But it is something to hear. And it's not something you hear right then, you hear it months later, years later even. Thank you so much. That was something that was, I was at a tough point in my life, and you were able to help me out of that dark ditch and feeling stuck in my life. So,
But I'm sure when you see a patient that connects the dots and you help them get there, that has to be rewarding.
yeah, and that's how I like to practice. I don't think it's really a psychiatrist's job or anybody in mental health to really tell people how to live their lives, as long as they're being safe, right? But whatever it is they want to do that makes them happy within reason, I want to help to get them there. So whatever they want for their career, whatever they want to do, it's just sort of, I kind of think of it as like almost like in a bowling alley where you have the bumpers up, right? They're going down. We're just there to sort of help you get there. And oftentimes it's, as I talked earlier, things periodically happen in our life. So there may be 15, 20 years where you don't need to see psychiatry. You don't need to see a therapist. So something happens in your life or something like completely out of our control. And that's what's important too. There's so many things that are out of our control. Whether it's our DNA, whether it's something like a pandemic, whether it's someone passing away in our lives, these are something medically happening to us. But what we do have control over is how we address it, right? So that is what makes this job so rewarding, is when they're able to start, and that's what I was talking about earlier with kind of college age students, those in their late teens, early 20s. They have so much potential, and they start here, and they've made it to where they want to be in life.
Well, and I think if you're on the outside looking in, it's frustrating to see somebody who's struggling at that age when you're thinking you've got the whole world in front of you, you've got your whole life in front of you, but you don't know what's going on. And there's a lot of things that can cause all sorts of things.
Right. It is one of those things that is, and family, we feel this way too, but certainly family does. There is an element of feeling powerless. At the end of the day, it has to be something that you want, right? Outside of extreme measures, you're really not able to force somebody into treatment. So if I tell people there's never a wrong time to enter into therapy, there's always something that we as human beings can focus on to improve, but it has to be something that you want to do. You're going to get out what you put in. So if you're not there for it, or if you feel like it's a chore or you resent it, you're not going to put much in, and then you're not going to get much out, and then you're going to say, well, I didn't get much out, I don't want to do it. So it's got to be something that you want to do, and that can be frustrating because usually as family members, we're the first ones that see when someone isn't doing well. So you try to encourage them, but it ultimately has to be that person to take that initiative.
Let's kind of run through just the range here. Let's start with kids, youth, all the way up. What do you see with various age groups? Kind of give us a snapshot.
Oh boy, we don't have like hours today, right? Geez, oh boy. So with children, it's a lot about family structure. It's family dynamics, right? A lot of learned behaviors. So a lot of the time, when I was in residency, Michigan has a children's stateside hospital, and a lot of the children that we would see there, yes, there would be some early onset schizophrenia, bipolar, but a lot of them had really unstable childhoods, and that created a lot of behavioral disturbances. So we see a large segment of that. We see, of course, disruptive kids in the classroom, ADHD, and general sort of anxiety. That's what we see. That, and then as it transforms, the stakes get higher and higher each sort of period in your life. And as I was talking about before, with high school students, college students, they're used to being students their entire life, and they say, "Oh, well, I'm not going to secondary school, but man, I'm used to being a student for 12 years now. What do I do?" So there can be some feeling a bit lost, and then of course you're always sort of comparing yourself to your peers. Mm-hmm. So in your teens and your 20s, you're like, well, this person's doing this person's doing this, and that's why I think a lot of times in society now we're starting to say when things happen for you, that's when it's right for you. So it doesn't necessarily have to be when everyone else is getting married or having children, getting a house, these sort of things. So, and then of course it progresses into your adult years where, if you have children, you have a career, these are times where you're sort of flourishing, but also you could call it, my program director used to always call it the sandwich sort of generation. You're dealing with your children as they're getting older, and you're dealing with your parents as they're getting older as well, but one is becoming more independent and one is becoming more dependent. So that's a very challenging time because you're trying to balance all of that and dynamics, and then of course your career and your personal life, your family. So it's very chaotic there, and then as things progress into your later years, into retirement, and as I was saying, filling that void with things, the kind of the smaller pleasures in life, and of course, as we get older, the ailments that come with that, and we slow down a little bit, and the adjustments that need to happen during that time too. So I hope that encapsulated the best.
It was perfect.
That I could.
Yeah. So how does somebody utilize your services? Are they calling Mind Body Wellness Center? Are they going to their primary care physician and having conversations with them and then referred to you? How does that work?
Well, both.
Okay.
Both. So there are times when people have neither of those and they feel very, very lost. Maybe they just moved to the area. Maybe they're a college student and they're able to talk to their family doctor, or of course if they are in crisis, they are able to come to the emergency department. Outside of that, we do encourage the patients themselves to call our clinic, whether it is Mind Body Wellness or the one on Alden Street, which is the Meadville Community Health Center. So, and then from there, we can have a conversation of what are you interested in? Is it dietary? Is it would you like to talk to a dietitian, because just eating well and sleeping well and exercising can help us to really feel good about ourselves? Or is it more medication management, or is it counseling, or is it all of it, right? Or are you interested in, I have a son who is, his teacher tells me that he's very distractible and impulsive and looking to get evaluation, so maybe he can have some sort of individualized program for him to excel in school. So all these sort of things, all these kind of needs that we can meet in the community.
Is there a website that people can go to get more information?
Yeah. So, I mean, it would be through the direct MMC website,
okay,
and then be able to follow those, what do they call them, cookies, I guess? I don't know. Tabs down to MMC,
Okay.
or Mind Body Wellness.
All right. Well, it sounds like there's a lot of great information. So if you have questions, you can call, you can go online, and of course, get to meet Dr. Tallarico in person and the great crew there. So
Thanks for having me. I appreciate
thanks for
it.
being with us.
Yeah.
Thank you for joining us.